All right, it is time for your health check, and it's the breaking news a lot of parents have been waiting to hear. Pfizer and its partner BioNTech just announced this morning that they're going to file for authorization of their 2-dose COVID-19 vaccine for use in children ages 5 to 11. So clinical trials, which were relatively small, under 3,000 kids, show that the vaccine was safe and well tolerated. Antibody response was similar to that in young adults, and any side effects were also comparable, although this dosage would be 1/3 the adult vaccine dose. Okay, so the response wasn't as profound as what we saw in adults. Data in children as young as 6 months could come in the fourth quarter, but important to note here, this data is from Pfizer. The FDA still has a very long process, Q&A, right? And so the 5 to 11-year-olds might be able to get vaccinated before Halloween is what we're hearing. A whole lot more on this coming up in later newscasts and, of course, on WFAA.com. Meantime, there is a grim statistic to share. The state of Texas has surpassed 60,000 deaths from COVID-19. And as we navigate this health crisis, you may have seen news about monoclonal antibodies. Okay, the government recently bought more doses of this COVID-19 treatment. So you might be wondering, what is this? For the answer, we turn to Dr. Morgan Hackey, interim head of the Division of Infectious Diseases at OHSU and the vice chair for clinical programs for the Department of Medicine. So what we were told, Dr. Hackey says the antibodies work by attaching to the virus and preventing the virus from infecting cells. The treatment has been given emergency use authorization by the FDA. It's not preventive, okay, so this can't prevent COVID-19. It is also not a substitute for the vaccine. Dr. Hackey says getting the treatment only works if you get COVID or if you're immunocompromised and you're exposed to COVID. The whole point of this treatment is to keep you out of the hospital. Now, under that FDA emergency use authorization, the treatment is reserved for high-risk patients. The treatment is given through an intravenous infusion or an IV administered by a nurse. However, since June, the treatment, can be given subcutaneously or as an injection under the skin. That means more hospital systems and clinics may be able to offer this treatment because you don't need a nurse to administer it, and that is huge, I know, in this country, and I know people in other countries are really looking at how this is working here and wondering how they can get their hands on monoclonal antibodies as well. All right, that is your health check. We're going to